The Da Vinci Surgical System, History, Present and Future. 1. Historical background and development. The concept of robotic surgery dates back to the early 20th century, originally introduced by Czech writer Karel Čapek through his play that introduced the term robot. However, practical applications began primarily in the military and aerospace sectors, where the need for remote operation in hostile environments led to advancements in robotics. Early innovations. In 1985, the first robotic surgical system PUMA was utilized for a neurosurgical biopsy. This was followed by the development of the ESOP robotic system, which received FDA approval in 1994 for endoscopic surgery, allowing surgeons to control cameras with voice commands. The birth of the Da Vinci system, Intuitive Surgical, was founded in 1995 and began developing the Da Vinci system. The first prototype, named Lenny, was created in 1998. The Da Vinci Surgical System received FDA approval in 2000, marking it as the first operational surgical robot in the U.S. 2. Key technologies and improvements. The Da Vinci system consists of three main components: a surgeon's console, a patient-side robotic cart, and an advanced imaging system. The robotic arms can perform a wide array of surgical tasks with enhanced precision. Technological evolution. The system has undergone several generations of development. Da Vinci S 2006 introduced high-definition 3D imaging. Da Vinci C 2009 enhanced with dual console capabilities and real-time fluorescence imaging. Da Vinci Xi 2014 featured improved cart design, flexibility in positioning, and advanced imaging technology. This model addressed several limitations of its predecessors, including ease of access and improved arm articulation. 3. Current status. As of 2020, over 5,700 Da Vinci systems were installed worldwide, used extensively in various surgical fields including urology, gynecology, and cardiology. The system has been particularly advantageous in minimally invasive surgeries, allowing for smaller incisions and shorter recovery times. Applications. Common procedures include prostatectomies, hysterectomies, and cardiac valve repairs. The Da Vinci system has revolutionized surgical techniques, allowing for greater precision and control. Criticism and challenges. Despite its advantages, the Da Vinci system faces criticism regarding its high cost, approximately $2 million steep learning curve for surgeons, and concerns about the lack of long-term outcome data compared to traditional surgical methods. Additional criticisms include the proprietary nature of its software and the potential for increased complication rates. 4. Future outlook. The future of the Da Vinci system and robotic surgery is promising, with ongoing advancements in technology and increasing competition in the market. Technological innovations. Future developments may focus on miniaturization of instruments, faster docking systems, and the integration of artificial intelligence to enhance surgical precision and efficiency. There is a trend towards creating smaller and more versatile robotic systems that can perform a wider range of procedures. Emerging competitors. While Intuitive Surgical currently dominates the market, new players such as Titan Medical and Auris Health are developing competing robotic surgical systems that could challenge the Da Vinci's hegemony. Conclusion. The Da Vinci Surgical System represents a significant advancement in surgical technology, combining the principles of robotics with minimally invasive techniques to improve patient outcomes. As technology continues to evolve, the system is likely to see further enhancements, potentially transforming the landscape of surgical procedures. Despite facing challenges, the potential for innovation and competition suggests a dynamic future for robotic surgery. Here is a direct response to your request. Highlighting counterintuitive information related to the Da Vinci Surgical System. Counterintuitive information. 1. High cost versus adoption rate. The Da Vinci Surgical System is priced at approximately $2 million, making it prohibitively expensive for many hospitals. Despite its high costs, the adoption rate has been significant, with over 5,700 units in use globally as of 2020. This indicates that hospitals are willing to invest heavily in technology that may not always demonstrate superior long-term outcomes compared to traditional laparoscopic methods. 2. Learning curve. The Da Vinci system is often criticized for its steep learning curve. While one might expect that advanced technology would make surgery easier to learn, the reality is that many surgeons find it challenging to master the robotic controls, which can lead to extended training periods and potential risks during initial surgeries. 3. Reported outcomes. Although robotic surgeries, including those performed with the Da Vinci system, are marketed as superior due to their minimally invasive nature, studies have shown that outcomes such as blood loss and complication rates are not significantly better than traditional laparoscopic surgeries. This challenges the assumption that robotic-assisted surgeries inherently lead to better patient outcomes. For a FDA approval process, the Da Vinci system received FDA clearance via the 510(k) pre-market notification process, which is less rigorous than the pre-market approval process. This could suggest that the system was allowed into the market without as extensive clinical evidence as one might expect for such a costly and complex device. 5. Integration with AI. As the future of robotic surgery looks toward greater integration with AI and automation, there is a counterintuitive notion that reliance on advanced technology could lead to a decrease in surgical skills among practitioners. While technology is expected to enhance surgical precision, there is a concern that it may also create a dependency that undermines traditional surgical training. 6. Emergence of competitors. Despite Intuitive Surgical's dominance in the robotic surgery market, several new competitors are emerging with different approaches to robotic systems. This is counterintuitive because one might assume that a well-established product like the Da Vinci system would face little competition. Yet companies are developing innovative alternatives that could disrupt Intuitive Surgical's market share. 7. Technological innovation versus clinical necessity. The rapid evolution of robotic surgical systems raises questions about whether these innovations are being driven by clinical necessity or by market forces. The introduction of features such as fluorescence imaging and single-port technology may not be directly correlated with improved surgical outcomes, suggesting that some advancements may be more about keeping up with competition than about addressing actual clinical needs. 8. Public perception versus clinical evidence. There is a gap between public perception and clinical evidence regarding robotic surgery. Many patients and healthcare providers view robotic-assisted surgeries as cutting-edge and more effective, even when clinical data does not consistently support these beliefs. This discrepancy highlights how marketing and perception can sometimes overshadow empirical evidence in medical technology adoption. 9. Use in training. The Da Vinci system has been touted for its dual console capability to enhance training for new surgeons. However, there is a paradox where the reliance on robotic systems may diminish the training experience and hands-on surgical skills, potentially leading to less experienced surgeons in traditional methods. 10. Surgical versatility versus complexity. While the Da Vinci system is marketed as versatile for various surgical procedures, the complexity of the technology can lead to operational inefficiencies. In practice, some surgeons find that the system may complicate procedures that could be performed more straightforwardly with traditional techniques, countering the expectation that robotic surgery simplifies complex surgeries. These counterintuitive insights highlight the complexities and challenges associated with the adoption and evolution of robotic surgical systems like the Da Vinci Surgical System. The Da Vinci Surgical System (DVSS) is a significant technological advancement in the field of robotic surgery, yet many crucial aspects of its history, current state, and future trajectory are often overlooked. Understanding these nuances can provide deeper insights into its impact on healthcare. Here are some key points that merit more attention. 1. Historical context of robotic surgery. Military origins. The origins of robotic surgery are significantly tied to military applications. The necessity for remote surgical capabilities arose during combat when medical personnel were unable to reach injured soldiers quickly. This led to the development of early robotic systems designed for telepresence in surgical settings. The transition from military to medical applications demonstrates how innovations in one field can catalyze advancements in another. Pioneering technology. The first robotic surgical system PUMA was used in 1985 for neurosurgery. However, the foundational concepts of robotic surgery can be traced back to the 1960s and 70s, where early prototypes began to emerge. Understanding this timeline highlights the gradual evolution and the collaborative efforts of various fields that contributed to the DVSS. 2. Technological evolution. Iterative updates. Each iteration of the Da Vinci System SC brought substantial enhancements, particularly in visualization and instrument dexterity. For instance, the introduction of 3D HD cameras and improved ergonomics in the SC system significantly improved surgical outcomes and reduced surgeon fatigue. The importance of user experience. The DVSS's design emphasizes user experience, which is crucial for reducing the learning curve for surgeons. However, the challenges associated with mastering the system remain significant, and the steep learning curve can limit its adoption. This aspect is often understated in discussions about its efficiency. 3. Current application scope. Wide range of surgical procedures. While many people associate the DVSS primarily with urological surgeries, its use has expanded into gynecology, cardiology, and even thoracic surgeries. The versatility of the system allows for minimally invasive procedures across various specialties, which is often underrepresented in mainstream discussions. Cost versus benefit analysis. The high cost of the DVSS, approximately $2 million, is frequently highlighted. However, the potential long-term savings from reduced recovery times and lower complication rates are often overlooked. A deeper analysis into these economic factors can provide a more balanced view of its value in clinical settings. 4. Criticism and challenges. Long-term outcomes. Despite the advanced technology, there is ongoing debate regarding the long-term outcomes of surgeries performed using the DVSS compared to traditional laparoscopic approaches. Critics argue that many studies do not conclusively prove superior outcomes, which is an important consideration for hospitals evaluating robotic surgery's cost-effectiveness. Training and accessibility. The requirement for extensive training to operate the DVSS effectively can be a barrier to its widespread adoption, particularly in facilities with limited resources. This raises significant questions about equitable access to advanced surgical technologies and the implications for patient care in underfunded healthcare systems. 5. Future directions. Integration with AI and machine learning. The future of the DVSS may involve deeper integration with artificial intelligence and machine learning, which can enhance surgical precision and decision-making. This potential is often discussed in broader technological trends but is not always connected back to the DVSS specifically. Emergence of competitors. While Intuitive Surgical dominates the market, the emergence of new competitors, e.g. Titan Medical, Auris Health, may disrupt the robotic surgery landscape. Monitoring these developments is crucial, as they may lead to innovations that could further improve surgical outcomes or reduce costs. 6. Cultural and ethical considerations. Patient perception. There is a growing cultural perception of robotic surgery as a high-tech superior option. However, this perception can sometimes overshadow the importance of traditional surgical techniques and the skills of the surgeon. Public understanding of these technologies is critical for informed patient choices. Ethical implications. As robotic surgery becomes more prevalent, ethical considerations surrounding its use, including informed consent and the implications of robotic errors, need to be addressed. The conversation often focuses on technological capabilities rather than the ethical frameworks guiding their use. Conclusion. The Da Vinci Surgical System is more than just a technological marvel. it encapsulates the intersection of medical advancement, economic implications, and ethical considerations. By exploring the often overlooked aspects of its history, current applications, and future potential, we can gain a more comprehensive understanding of its role in modern medicine. This nuanced perspective is essential for healthcare providers, policymakers, and patients navigating the complexities of robotic surgery. The Vinci Surgical System has had a significant impact on the field of robotic surgery since its inception. Here are the 4 most valuable points for in-depth analysis and discussion regarding its history, present, and future. 1. Historical development and milestones. The historical context of the Vinci Surgical System illustrates a journey of technological evolution in surgical practices. The concept of robotic surgery can be traced back to military applications and early robotic prototypes like the PUMA in 1985. The establishment of Intuitive Surgical in 1995 marked a pivotal moment when the company began to focus on developing a sophisticated surgical robot. The introduction of the Vinci system in 2000, which gained FDA approval, represented the first operational surgical robot in the U.S. This timeline showcases not only the technological advancements but also the integration of robotics into medical practices, highlighting how military and industrial innovations have paved the way for modern surgical techniques. 2. Technological advancements and system composition. The Vinci system's design consists of several critical components that work in tandem to enhance surgical precision and outcomes. The system comprises a surgeon's console, robotic arms, and a high-definition 3D imaging system. The evolution from the initial models to the latest CHI system reveals significant technological improvements such as enhanced visualization, increased dexterity, and reduced invasiveness in procedures. The introduction of features like firefly fluorescence imaging technology and the integration of artificial intelligence for better surgical outcomes illustrates the ongoing evolution of the system. These advancements not only improve the surgical experience but also raise questions about the future capabilities of robotic surgery as technology continues to progress. 3. Current applications and challenges. Today, the Vinci Surgical System is widely used in various surgical disciplines including urology, gynecology, and cardiac surgery. Despite its growing popularity, the system faces significant challenges. The high cost of the equipment, around $2 million, a steep learning curve for surgeons, and ongoing debates about its long-term effectiveness compared to traditional methods are major hurdles. Research indicating that outcomes from robotic-assisted surgeries are not significantly superior to those from laparoscopic techniques has prompted criticism. Additionally, concerns over the training provided to surgeons and the potential for serious complications have led to increased scrutiny. These challenges highlight the need for continued research and evaluation of robotic surgery's role in modern medicine. 4. Future prospects and competitive landscape. Looking ahead, the future of the Vinci system appears promising but faces potential disruption from emerging competitors. Companies like Titan Medical, Transcentrix, and Auris Health are developing their own robotic systems which may offer alternative solutions to healthcare providers. Innovations such as smaller, more efficient instruments, automated tool exchanges, and enhanced integration of artificial intelligence are expected to shape the next generation of robotic surgery. The competitive landscape could drive advancements in technology, making surgical robots more accessible and affordable. As the field evolves, ongoing collaboration between engineers, surgeons, and healthcare institutions will be crucial in shaping the future of robotic surgery and ensuring it meets the needs of both patients and providers. In conclusion, the Vinci Surgical System is a significant advancement in robotic surgery, but its future will depend on addressing existing challenges and adapting to a rapidly changing technological landscape. The interplay between historical milestones, current applications, and future innovations will continue to shape the field of surgery for years to come. 1. The development of the robotically assisted surgical system (RAS). The evolution of robotic surgery began long before the Vinci system's introduction. In 1985, the PUMA 560 became the first robot used in human surgery for a neurosurgical procedure. It served as a precursor to future robotic systems by demonstrating the feasibility of robotic assistance in delicate surgical tasks. The development of the robodoc in the early 1990s further advanced the field, as it was the first robot designed for orthopedic surgery, specifically for hip replacement procedures. These early systems laid the groundwork for the more sophisticated Vinci system, showcasing the potential for robotics to enhance precision and reduce invasiveness in surgical practices. 2. The Zeus Surgical System. The Zeus Surgical System, developed by Computer Motion in the late 1990s, represents another significant milestone in robotic surgery history. It introduced the concept of telepresence in surgery, allowing surgeons to control robotic arms from a console, thereby enhancing dexterity and precision in minimally invasive procedures. The Zeus system was notable for its dual console capability, enabling collaborative surgeries where multiple surgeons could operate simultaneously. Although ultimately overshadowed by the Da Vinci system after a merger in 2003, the Zeus system's innovations contributed to the broader acceptance and development of robotic surgical technologies. 3. The remote telesurgery of Jacques Marescaux. In 2001, a landmark event in the history of robotic surgery occurred when Dr. Jacques Marescaux performed the first transatlantic robotic surgery using the Zeus system. This procedure, known as Operation Lindbergh, involved a cholecystectomy performed on a patient in Strasbourg, France, while Dr. Marescaux operated from New York City. This groundbreaking event showcased the potential of robotic surgery to transcend geographical barriers and highlighted the future possibilities of remote telesurgery. It emphasized the capabilities of robotic systems in performing complex surgeries from a distance, paving the way for future innovations in surgical practice. Future outlook for the Da Vinci Surgical System. The Da Vinci Surgical System, developed by Intuitive Surgical, has revolutionized minimally invasive surgery since its introduction in 2000. As we look toward the future, several trends and predictions can be anticipated for this robotic surgical system, including advancements in technology, market competition, and changes in surgical practice. 1. Technological advancements. Integration of artificial intelligence (AI). Future iterations of the Da Vinci system are likely to incorporate AI to enhance surgical precision, assist in decision-making, and improve surgical outcomes. AI could analyze vast amounts of surgical data to provide real-time feedback to surgeons, suggesting optimal techniques or adjustments during procedures. Miniaturization and portability. As technology continues to evolve, we may see smaller, more portable robotic systems that are easier to deploy in various surgical settings. This could enable the use of robotic surgery in smaller hospitals or even in outpatient settings, broadening access to advanced surgical techniques. Enhanced visualization technologies. Future models may employ augmented reality (AR) and advanced imaging technologies, providing surgeons with enhanced visualization of anatomy and pathology. This could significantly improve the accuracy of surgical interventions and reduce complications. Automated instrument exchange. One of the notable advancements could be the automation of instrument exchanges during surgery. This would streamline procedures, reduce surgery time, and minimize the need for additional surgical staff. 2. Market competition. Emergence of new competitors. While Intuitive Surgical currently holds a dominant position in the robotic surgery market, several companies are developing competitive robotic systems. Companies like Titan Medical, Auris Health, and Transentrix are working on new platforms that may offer features or pricing structures that challenge the Da Vinci system's market share. Cost-effectiveness and affordability. As competition increases, we may see a push for more cost-effective robotic surgical systems. This could make robotic surgery more accessible to a wider range of healthcare facilities, particularly in developing countries or smaller hospitals that previously could not afford such technology. Regulatory changes and approvals. as more robotic systems enter the market, regulatory bodies may adapt their approval processes, potentially streamlining the pathway for new technologies. This could accelerate innovation and the introduction of new robotic systems. 3. Changing surgical practices. Increased adoption in various specialties. The Da Vinci system's versatility means it could see increased adoption across various surgical specialties beyond urology and gynecology. Fields such as orthopedics, thoracic surgery, and general surgery may increasingly integrate robotic techniques into their practices. Training and education. As robotic surgery becomes more prevalent, surgical training programs will likely evolve to include more comprehensive training on robotic platforms. This could include simulation-based training, mentorship programs, and a focus on developing the skills necessary to operate robotic systems effectively. Patient-centric approaches. The future of surgical practices may increasingly focus on patient outcomes and satisfaction. Robotic-assisted surgeries often result in shorter recovery times and reduced hospital stays. As such, hospitals may promote robotic surgery as a preferred option for patients, leading to greater demand. 4. Addressing criticisms. Research and development for long-term outcomes. To address past criticisms regarding the lack of evidence for superior long-term outcomes compared to traditional laparoscopic surgery, future research will likely focus on comprehensive studies to demonstrate the benefits of robotic surgery. This will be crucial for gaining acceptance among skeptics and enhancing the Da Vinci system's reputation. Cost justification. Efforts will be made to quantify the cost-effectiveness of robotic surgeries. As data becomes available demonstrating cost savings through reduced complication rates and shorter hospital stays, hospitals may be more inclined to invest in robotic systems. Conclusion. The future of the Da Vinci Surgical System appears promising, with technological advancements, increased competition, and evolving surgical practices anticipated to shape its trajectory. As the healthcare landscape continues to evolve, the integration of robotics in surgery will likely play a crucial role in enhancing surgical outcomes, improving patient experiences, and expanding access to advanced surgical techniques. The next decade will be pivotal in determining how robotic surgery is integrated into standard surgical care and how it continues to innovate in response to emerging challenges and opportunities in the field of medicine.